Hello and welcome to Spine Care Fitness, where we teach you how to be your own personal body mechanic so that you can fix yourself. My name is Laura Fields. I'm a sports medicine physical therapist, and today we're going to learn about the spine, the properties of the spine, the anatomy and the physics of the spine in certain typical problem areas of the neck or the low back that happen to everybody, and simple techniques that you can do to take care of that pain. All right, let's get started. This is your spine. This is the side view. Here's your cranium up here, your skull, and here are your hip bones, basically. As you can see, this spine is in an S curve. It's supposed to be. It's not supposed to be perfectly straight. If it was perfectly straight and you stepped off a curb or something, you'd shatter your vertebrae. The bone would be brittle. So it needs to be in this S curve to act as a spring, a shock absorption property to protect what's inside. Inside is the spinal cord. The spinal cord then branches out in all of these nerve roots so that your arms are innervated, and further down here so that your legs are innervated. The lower the nerve root, the lower in your leg is affected or controlled. So there's that. Now what happens through life and gravity is we lose specifically this curve and also the curve in your neck, and it becomes flat and stressed. And that's going to create these discs to bulge out or squish out into the nerve root. And the signs and symptoms of that is pain, shooting pain, numbness, tingling. You go to bend over to pick up anything, it can be a piece of paper or a box or something, and you get this lightning bolt jab in your back, knocks you to your knees. Happens to all of us. I call it a back attack. When we get onto the mat, I'll show you how to get over that back attack so it doesn't become a completely blown out disc. Talking about the disc, each segment of vertebrae has a protective disc in between. Okay, now that you know the basic shape of the whole spine, we're going to zoom in on the most common degenerative joint of the spine, which is L4, L5. These two vertebrae, because we sit and we're a relatively sedentary society with computers and technology, this disc right here just gets crunched, and we keep bending at that area. So we're going to zoom in on that point, and then I'll show you what the disc is doing. Typically, we've heard of slip disc, but I'm here to tell you the disc is well attached to the vertebrae above and the vertebrae below. A more accurate description of the disc is it's a gel-filled tire that acts as, again, a protective component for the spinal cord and the spinal nerve roots. What slips, if you will, is the gel within the center of the disc squishes out. Here's a perfect example. When we're sitting and compressing, you see how the front part of the disc is compressed. What happens over time, or if you then lift something suddenly, or you cough or you sneeze, this can happen. The gel squishes out, and the disc can press right against that nerve, and it is painful because the disc is the nerve is saying, get the hell off me. And so you want to decompress the disc, re-centralize the gel back into the center.
Well, thanks so much for stopping by to SpineCareFitness.com. You can check out our site at www.SpineCareFitness.com. Thanks so much. Have a great day.
For even more great videos and resources, subscribe to our newsletter by visiting us at www.SpineCareFitness.com. And just as a thank you for signing up, you'll get access to our subscriber-only video, the Back Attack Negotiator.